So while COVID-19 cases have been on the decline in South Africa, coronavirus-related deaths have been on the rise in the past couple of days. On Tuesday, the country recorded 119 deaths, and yesterday 181 people succumbed to COVID-19. Hospitalizations have also been on the rise. We speak now to Dr. Mvuyisi Mzukwa of the SA Medical Association. He's the vice chair there. Dr. Mzukwa, thank you very much for availing yourself this afternoon. This has been termed a slight increase, but an increase nonetheless. What should we understand about this?
Good afternoon to you, Dudu, and to your viewers, and Happy New Year to all South Africans. What we understand about this is that we all know that there's a lag when it comes to admissions and deaths. So what we call complications of the disease. So this is what we're experiencing now, that even though numbers are dropping, because remember this takes time, it takes about 2 weeks or so to see the complications. So you would expect that by this time we'll be, even though seeing a drop in the numbers, but we'll still see a rise in the complications for those patients who might have been admitted or have occupied healthcare institutions.
And this is happening as health authorities go through great pains to encourage people to get vaccinated.
Yes, for obvious reasons, because I think it's now public knowledge that people who are vaccinated or those who are hospitalized, a majority of them are not vaccinated. So you'd expect that people would learn from what we have seen to say let's go get vaccinated so that we get that protection of not going to hospital, but also of avoiding death. So I do think that I would also join that chorus of encouraging South Africans to go out there and make sure that they get those jabs. And if they need a booster, they should follow the booster in the recommended way.
And scientists saying that we may be moving towards the endemic phase, meaning what essentially?
Well, it means that this is now going to be regionalized instead of becoming a global crisis. We might need to deal now with surges in certain regions, and I do think that solidarity must still prevail, as we are always led by the World Health Organization. So we do see obviously weakening of this pandemic. So that doesn't mean we must obviously put our guards down. We still have to observe all these non-pharmaceutical interventions, but it looks like there's a light in the end of the tunnel.
The Africa CDC coming out to say that South Africa accounts for 40% of deaths on the continent. What you make of this observation?
Well, definitely we do think that there are issues. Obviously, we will need to look at many other factors. One of those being how many elderly in that group of people are dying, but also people with underlying medical conditions. But also knowing that South Africa is having lots of congestion in terms of numbers of people in the continent. I do know that Nigeria is one of those, but South Africa, that most of the SADC countries, they find their citizens in this country. So there's many factors that contribute to that. Also that we have started late with the issue of vaccinations.
Dr. Mvuyisi Mzukwa is the SA Medical Association Vice Chair. Always a pleasure. Thank you for your time.